everyone, so I'm going to show you an RCT setup. So my RCT setup will start with a basic setup. So I have cotton forceps, I have a mouth mirror, and I have an explorer. I also have an air water syringe. This setup will go ahead and be on doctor's side. I have doctor's gloves ready. I also have in this case, I would be doing a posterior PA, so I would be doing a posterior tooth. Where are my posterior teeth? If I'm looking at my patient's mouth, okay, my posterior teeth are after my canines. So after my canine, all of these would be considered posterior teeth on both sides. Posterior teeth. So that would be your molars and your premolars. I have my PA set up, and when I'm doing my PAs, let's say I was going to do my PA on my patient, and I'm sorry, I'm holding it with my hand. So when I'm doing a PA, the way that it's set up is I can go into my upper left arch, or I can go onto my lower right arch. The reason I cannot go from the top to the bottom is because the way that my setup is positioned, I can definitely go like this, but I can't go like this because then the rod itself would be pushing against the patient's cheek and would make it very, very uncomfortable for my patient. So upper left, lower right. That is my posterior PA. Remember, your posterior PA setup comes with a rin, a rod, and a bite tap. My next thing on my setup is going to be my topical. So I have my topical here. Always remember to ask your patient if they are allergic to any type of food product or anything in general. So then we make sure we are not going to have our patient go into anaphylactic shock. We also have our 2x2 gauze, and we have our cotton tip applicator already preset with the topical on it. Next, I have my anesthetic syringe, and it comes in 4 parts. I have my anesthetic syringe itself, my anesthetic carpule, my anesthetic needle, and my sheath protector to make sure I do not poke myself when recapping our needle. Remember, we never want to recap our needle without using some type of safety device. I also have my burr block along with my burrs. Your doctor will indicate what kind of burrs he or she would like to use. I have an exposed developed film, and I have film that has not yet been exposed or processed. Here I have my high-speed handpiece. And I also have my endodontic slow speed handpiece along with the burrs. I have my LVE, which stands for, I'll give you a second. That's right, low volume evacuator. And I have my HVE, always with the bevel to the top. What does HVE stand for? That's good, high volume evacuator. I also have another air water syringe tip because doctor will have one on his side and I will have one on my side. I have the patient bib. Don't forget our patient bib. We always need to make sure that they are clean and we do not get them dirty. Here I have my endo brooches. Remember, these look like little upside down Christmas trees or like barbed wire. We never want to graze them with our fingers because it will cut our fingers. If I get close enough, hopefully I can show you that they have little barbs on them, and that's to remove the pulp. Alrighty. I also have my Endodontic Explorer. It has the same on both sides. I also have my burn instrument. Next to that, I have my monojet with 50-50, 50% sodium hydrochloride, 50% water. Always pre-fill it before doctor comes in the room. I have my RC Prep. It's a lubricant for my files. I have my gutta percha in different sizes. This is what our gutta percha looks like. I have my 2x2 gauze. Here I have my crown and bridge scissors to cut my gutta percha. I have my bite block. I have here my bond, my micro brush, my mixing spatula, my glass slab, my acro seal. I also have my torch. Here I have my rotary instruments. I have my paper absorbent points, which this is what they look like. I have my endodontic files. And if we want to see what a file looks like outside of its casing, here it is. Very different compared to the brooch itself. So that would be the brooch. So the blue is a brooch and the black is a file. And if I get close enough, you can see where the file itself, it's like a screw. But the brooch, on the other hand, is barbed. And that will cut you. So do not graze your fingers against it, not even with gloves on. So our files will measure the canals, see how deep and how wide they are. And your doctor will let you know what length he will like or she will like. The last thing that we're going to have on here is going to be a pin. The reason for the pin is to write down what size of files that we use and what side those files are going to use. And I'm sorry, I can't really remember whether I did mention our composite dispenser and our composite carpule. But in case I didn't, that's what those are. So going back to the pin, you want to make sure that you are writing down the measurements to each canal. So if I'm doing a lower mandibular third molar, or if I'm doing a first molar, if I'm doing a premolar, I want to write down what size I use for each canal on those files. So if my doctor tells me that he used a size 15 file, I would write down size 15 file, and then he's going to tell me what the measurements are going to be. If you see on the file itself, you see how it has that yellow rubber stopper? That yellow rubber stopper is movable. So I can move it down. And doctor's going to measure at that rubber stopper what the measurement is inside of the canal. So let's say he told me, for this sake, it was a 40 file. So I would put 40 file on the mesial root of number 31. And it measured at a 15 millimeters. I would have to write that down and put it into my documentation for my patient. So this is my endodontic setup, one that has been used with many, many dentists. So if you have any questions, please leave a comment and I will get back to you as soon as possible.